Good afternoon, everyone. My name is Errecca Flynn Walker. This is the Raymond Hall Show, and we look forward to our conversation, the different conversation that we're going to be having today. Today, we have a guest. Her name is Miss Cassidy, Elaine Cassidy. She's an activist, retired judicial assistant, Los Angeles Superior Court System. She's a mother of 7 and 22 grandchildren, and we look forward to this conversation with her today. Good afternoon and welcome.
Thank you. I look forward to this conversation too.
Right now, we're doing some not pre-op, but Mr. Hall hasn't arrived yet. So what we're going to do is we're going to start out with the conversation about the Raymond Hall Show. It's a unique weekly internet broadcast that promises to discuss the importance of service nationally and throughout our communities. We take pride in giving you informative information, and our banner is Service, a Different Conversation. Speaks to both the mission and the vision of the Raymond Hall Show. Our mission is to showcase conversations, service, people serving in various ways to help produce positive outcomes for the present and communities to come. Our broadcast is committed to informing and showcasing the vital importance of service that builds, bridges, and enhances the quality of life for all. What I like to say is that it's been a remarkable ride and treat to be here with you on the Raymond Hall Show. We're going to start out by asking Miss Cassidy to tell us a little bit about herself and her activism in the community.
Well, I'm a Southern California resident, and I've been in my home for a long time. And I'm very active on Facebook, and I'm supportive of my granddaughters who are very involved in Black Lives Matter.
Okay.
Me and my girlfriends did fundraisers when President Obama was running.
Wow.
And we raised over $3,500
Beautiful.
And sent it to his campaign. And personally, I just acted as if it was a utility bill.
Okay.
Every month, I just sent that money in. Yeah.
Automatically.
Automatically.
And that was a great accomplishment, I'm sure, for you guys.
Yes. Uh-huh.
About how many of you, took part in that?
There was about 20 of us.
Oh, okay.
And our barbecue was held at a church, and there were games, and some of the ladies were very creative.
Really?
And, people dropped by, and we sent the funds to his campaign.
Which we all know made a difference, because that was one of his main things, is that it was the small, minor amounts that people sent in, from $5, $10, $3,500, that made all the difference in the world in his campaign fundraising.
And so I've continued that today with elections in other states for Democratic candidates. Sometimes I send $1. Sometimes I send $3.
Wow.
And it does make a difference. If millions of people send in $1, that's $1 million.
That's $1 million, just $1 at a time. You know something? That's the basis of everything. $1 at a time makes all the difference in the world. So tell me about the candidates that you're going to be helping to promote coming up for our Democratic Party.
Well, the races have passed. One was in Minnesota. One was in Ossoff.
Yes,
that came in very close.
Yeah, it was very close.
But currently, I'm sending money to the ACLU.
Okay.
And Black Lives Matter.
Black Lives Matter.
And the Democratic Party, when they ask me, like Kamala Harris will ask for contributions, especially on this health care fight.
Right.
And this money pays for ads and for people to be on the ground talking to other people and encouraging them and informing them of what Trump Care would mean to the
Yes,
nation.
yes.
And so I'm very passionate about that.
Okay, so you touched on something that was very important and passionate to you. The effect that it's going to have on the family directly to you. What can you say to our audience out there to let them know that each and every opportunity will have an effect on your family with all of the new things that we have coming up with the health care and the tax bill?
Quite a few things in the federal government will be cut.
Okay.
Federal aid for education, federal aid for Medicaid. My son had to go out of state for a time period in his life because there were no jobs here, right when the market crashed and everything. And when he came back, he got custody of his kids.
Okay.
Now, he was a minimum wage worker at that time.
Okay.
He could not afford health care. So it was like emergency room,
right,
or you save, or you try to make do at home.
Right.
So I personally saw that. Now, in California, we are very fortunate.
We are.
Because Medicare picked up the slack.
It did. It expanded, and that's what gave us the Affordable Care Act.
That's right. And so he no longer had to worry about that type of situation. So I personally saw that firsthand.
So, that's the same thing I was just speaking to my cousin about the other day, that although there are people, they're well off, they're fortunate, we all have people that we know directly that these cuts will affect. And that's the part that concerns us the most. It's not just us directly, it's our cousins, our daughters, our sons. And so, we all have to be conscious and cognizant of this vital and very important time.
And it's not just here in California. We are, like I had said before, we're very fortunate. In some of your so-called red states,
right,
people have so little health care that they use the emergency room like their doctor's office.
Right.
And so many hospitals have gone bankrupt because their state's government refused to sign up to expand Medicaid.
Right.
So it didn't reimburse the hospitals for that care.
And so the hospitals couldn't
close their doors
because we seem to think that just because we have this coverage in California, there's 39 states that did not expand or take on the American Affordable Care Act. So we are very fortunate in California that we were one of the ones that it expanded to. Well, now we are at a crossroads, and so we all have to make some very important decisions and choices. So also, I was going to ask you about the Black Lives Matter movement that you said your granddaughters and your daughters are a part of. Tell us about that.
Oh, well, I would need them here to give you more details.
Right.
They slept at City Hall.
Wow.
In the tents, and they did the marches, but they stayed in touch with me and their parents on Facebook Live.
Wow.
So we could say if it was a situation that they have very good sense.
Okay.
But we're like protective of them. So if we heard too much noise in the background, like it was getting violent, we would ask them, "Are you heading towards your car now?"
Right.
And
you could be there live, and that's the new feature that Facebook is offering, which is a very, very good thing.
It's a good tool.
It's a very good tool,
and we could help keep them safe.
Exactly, and they know that you're only a phone call or a Facebook call away.
That's right.
Well, something, that right there it's a remarkable outcome that we're having from all this new technologies that are being introduced every day, because that's the new something new that we have. So we appreciate it, and we're going to take our opportunity to use it more often. So what we want to do is vote.
Yes, that's one of my favorite sayings.
Okay.
Democrats who stay on the couch vote for Republicans. They get
no vote is a vote, pretty much.
Right. That's correct. I like to go online and do research and there are actually 48% registered as Democrats.
Wow.
And 44% registered as
Republicans.
as Republicans.
Okay.
But in the 2016 election, 9% of the Democrats did not even vote.
Wow.
Yes. And 42 of that 9%, 42% of that 9% was Black and Asian.
So what do we do knowing these numbers? How can we start to make a difference?
And you know what, the win was so narrow.
It was so
in
narrow.
6 states. Trump won by 1% or less.
Wow, you hear that, audience? 1% or less. That's a narrow margin for all of you people that are wondering how did it ever happen? How did Trump get in office? It was a very narrow margin.
Part of the problem is the gerrymandering, the closing of polls. In Arizona, prior to the 2016 election, there were 200 polling spots. But for the 2016 election, there were only 90.
Wow.
So they had been cut
by almost over half.
Yes, and low income, minorities are traditionally in low wage
Positions.
jobs.
Yes, they are.
And they can't take off from work, or they're working 2 jobs, and so it's hard to get to the polls.
Yes,
that's
it is.
Also, and then when the polls are closing early and limited, they have to drive long distances. That's another thing I write my representatives about. I think we should be able to vote on Saturdays and Sundays.
Good point. Good point.
And when I was working 2 jobs, because I had 7 kids, and
Right.
I was working 2 jobs, I signed up for absentee voter.
Yes, which is very good. My mom and dad they use the absentee vote. And I think a lot of people don't really know about that. But anything that you have to do to make sure that your vote is placed and counted is vital, from here on out. What I like to say is right now, we're coming to you from the Raymond Hall Show. My name is Errecca Flynn Walker, and we're going to take a quick break right now, and we will be right back with you with Miss Elaine Cassidy. Thank you. We'll be right back.
Show. This is Raymond Hall, your host, and I want to thank co-host Errecca Walker and thank our guest, Miss Elaine Cassidy, and we have with us Mr. Anthony
Right.
Mr. Anthony Wright. He is the executive director for Health Access California. Mr. Wright, are you there?
I am. Thank you for having us.
All right. Thank you for being here. It's been one of those days. I was one of those people that got my system hacked, and it just wreaked havoc reverberated all throughout the office. But we're going to get right into it because I am told by a number of people that Health Access is one of the organizations that's on the front line of making a difference, making the community aware of things, and just doing so many other things to help people become aware of what's at stake here for all of the bills and the legislation that's going on. So talk to us a little about what Health Access does, and then tell us about your involvement.
Hi, yes. Health Access California is the statewide healthcare consumer advocacy coalition. We've been around for 30 years working for the goal of quality, affordable healthcare for all. For the last decade, we've been working on the cause of healthcare reform, trying to work to expand coverage and make sure that people have the consumer protections they need to get the care that they deserve. And a lot of that has been in the work of not just passing the Affordable Care Act, but making sure that California implements it and improves upon it. And through that work, California has, in fact, dramatically reduced the number of uninsured, cut it by more than half, from 7 million Californians to less than 3 million. and has put in place a number of other important patient protections and improvements in the healthcare system. But right now we're, in the fight of our lives to
Yes, we
try
are.
to defend those advances going forward.
You're absolutely right about that. And you hit on so many points so quickly. I guess that when you all are involved in it on a day-for-day basis, we are involved in that. It affects all Californians as one way or another. It affects all Americans. But we want to commend you for your work on the Affordable Care Act.
Thank you so much.
Yes,
for everything you
because if a person is not healthy, a person cannot enjoy their lives, to the fullest. So we want to thank you for that. So now let's get right to this, because we're just hearing disturbing things everywhere you go, whether you go in the churches or whether you go in
the
some of
grocery store.
the grocery store. No matter where you go, People are talking. Okay, and so I just want to thank you again for coming. So what is the truth, and what do we need to know about this thing?
So right now, the U.S. Senate is currently considering a bill that would dramatically undo not just the progress of the last 5 years with the Affordable Care Act, but the last 50 with Medicaid.
Mm-hmm.
The proposal in front of us that the Senate may vote on as soon as they get back from their July 4th recess would do a couple of things. The biggest one is a huge cut to the Medicaid program,
Yes.
$772 billion.
Billion. With the B.
And
Okay, so now with that huge a cut, let's bring this to somebody's front door. Let's bring it to their kitchen table. What does $700+ billion in cut look like? What does that mean? A complete cut of preventive care? What does that really mean once it gets home?
We lost him.
Look
we lost the caller.
we lost Mr. Wright. But let's talk about some things while the engineer works on that. We have with us Miss Cassidy. He's back.
Okay.
yes.
Anthony. Okay. So what
So
does that
the
really
Medicaid-
mean at the table, at the kitchen table? What does $700 billion mean?
So $700 billion, it's a 26% cut in the Medicaid program in 10 years. It actually would be a bigger cut, a 35% cut, or a third to the 14 million Californians who depend on the program.
Okay.
Right now, the program right now covers a third of California, including half of all children and 2/3 of all seniors in nursing homes.
Wow.
What this would get rid of the Medi-Cal expansion that covers about 4 million of those folks. So there's about 4 million people who just lose health coverage altogether.
Wow.
But then the rest of the people in the program would face this cap, this cut in the services, and that would mean everything from reduced benefits, harder ability to get doctors, and probably many more losing coverage altogether. Because the cut is done at the national level, but then it allows the state to implement it. We don't know exactly that this person will lose coverage altogether versus that person will lose dental and vision benefits, will lose prescription drug benefits, would lose the ability to get in to see a doctor. But a cut of this severity, in California alone, $30 billion a year is enormous. I mean, just to give you a comparison, $30 billion is how much the state of California spends on all of higher education, including the UCs, the CSUs, the community colleges, and all of corrections combined. So it's not a figure that we can make up by looking under the couch cushions, right? It's a staggering amount of money.
Staggering.
I've got to ask this question. When someone proposes something like that is so draconian, is there a mechanism for America to say that's un-American? I mean, maybe I'm stepping outside.
I think that's why they've had trouble. Their plan was to have voted and passed this bill today.
Yes.
Okay.
They had to delay that because there was some senators getting cold feet. They also were trying to just jam this through.
Yes.
This bill was literally introduced for anybody to see a week ago, and they were trying to get it voted on today because they knew that the more this sees the light of day, the more that people would rise up and push back.
Okay.
And the fact that it got delayed is an indication that this goes beyond the pale, even for those who really want that $800 billion tax cut to the wealthiest, which is where the money would go that would be saved from making this cut to our healthcare system.
Okay. So that was one of the questions that I thought, is this really about a healthcare or is it about a tax cut? That's
Tax cut.
yeah.
Mr. Wright, tell us, when you say tax cut, I'm a little confused. When you say tax cut and the money going to the billion, talk to me about that in layman's terms. A tax cut versus you taking the money and it's going to be given to the wealthy. I don't understand that part.
So, the bill is about a $772 billion cut to Medicaid,
Okay.
and it's about an $900 billion tax cut to the wealthiest, those who make over $250,000 a year, as well as some drug companies and insurance company executives. So it's not money that goes to deficits, not money that goes to education or some other part of the budget. It's money that's given right back out to the health industry and particularly to the wealthiest. Billionaires would get literally tens of millions of dollars in a tax cut. Whereas the other parts of the bill would actually increase taxes for low and moderate income Californians in America.
So you'd be increasing taxes on the very same people that you're cutting services for.
Yes, because the other part of the bill, I talked about the Medicaid.
Right.
But the other part of the bill is a reduction of the tax credits that they get now to be able to afford coverage. So right now in California, people buy coverage in Covered California and get affordability assistance so that they don't have to spend more than a certain percentage of their income on coverage. This would dramatically reduce that assistance, reduce those tax credits, making their taxes and their health insurance more expensive in order to.
Did we lose Mr. Wright?
Did we lose him again? Okay. While the engineer works on that again.
These numbers are really, really staggering.
Yeah. Not only are they staggering.
They're sobering.
They're sobering. Because I won't even say the word depressing because it makes you want to get up and do something. You know, if this doesn't move you, I don't know what will, because this is talking about health care for your future. As you and I were talking, we were
10
talking
years
about
out.
your family, the people that come after you.
But even right now, a lot of my friends in my age group have chronic diseases, on dialysis, high blood pressure, diabetes.
He's back.
Okay.
You back
All
with
right.
us?
So, Anthony?
Yes.
Okay. All right. So, and we know your time is limited. So we're what we want to get to is some of the takeaways. What are you urging people to do in order? We know this vote is going to come up next week.
Right.
What can we do?
So a couple of things. One is we need to contact our representatives, our senators, our representatives, to make sure that they know that this is not the direction that America needs to go. That we need to oppose them, and so to oppose this legislation, and that no little tweak. There's a lot of efforts to try to make some small changes to the bill and see if they can buy off a senator here, a legislator there, but. We need to have a lot of calls into members of Congress, to senators, approach it. Here in California, there are 14 members of our delegation that voted for this bill when it was in the House and may have to vote for it again for its final passage. But there's also senators around the country. There's Republican senators in some key swing states that where it will really make the difference. And so if you know people in West Virginia, in Arizona, in Nevada, in Ohio, in Colorado, you tell them to call their senators daily to make sure that you do not vote for a bill that cuts and caps Medicaid and takes away coverage from 22 million Americans.
Okay. All right. Now, When is this scheduled, as you know, when is this scheduled to come up for a vote?
This is scheduled to come up for a vote in the next few weeks. It was supposed to come up this week. They're delaying it till after the July 4th holiday, and so they'll be back in Congress in session on July 10th, July 11th, and so they need to hear about it between now and then. And if any of them show their faces in the community, at a July 4th parade,
right,
picnic, at a certainly town hall,
Right.
We need to ask them that question. Okay.
On this.
Okay. Now, is not the House and most of the Senate up for re-election next year?
All of the House and a third of the Senate is up for re-election next year.
Okay.
There's a couple of these swing state senators, like Senator Heller in Nevada and Senator Flake in Arizona, that are up, and this will be a major issue in those campaigns.
Yes, it will.
Okay. All right. Well, I want to thank you again for coming. I don't know if our time has run out, but I don't want to overstay my time, because we would definitely like to have you again. And I would be remiss if I did not mention Rachel and Nancy, and also for you, because we called at a very short moment. We had planned a show on cancer, and the high rates that is hitting impoverished communities. But this was so important because we're having one opportunity before they vote to let everyone know that you need to do something about it. So the floor is yours. Whatever before you leave, if you have to leave, if don't, we'll continue the conversation. But before you leave, what is it that you want everyone to know about the very importance of this, about what it will do today and what it will do 5 or 7 years, 10 years out?
Is the maturity of it.
Yeah, no, I think that I think one of the scary parts is we don't know all the interlocking and unintended consequences of this bill, because it really has only been out for just a week. There has not been a single hearing on this bill. They've been trying to jam it through without any of the sort of public deliberation and process that, for example, happened during the Affordable Care Act, which took a year and literally hundreds of amendments and literally dozens of hearings. Mm-hmm. And the reason why is because they know that the more it gets looked into, the more devastating the impacts would be, and the more people would be turned against it, even though right now there are polls out there that say that its approval rating for this bill is at 17%, at 12%.
Right.
And at some point, my hope is that enough of them say, we just need to walk away from this. There's no benefit to our community or even for the politics of it for them to continue down this path. There are improvements in our healthcare system that we need to make, but all these go in the opposite direction. We need to lower deductibles, not raise them. We need to invest more in Medicaid, not cut it. And that's the issues that we're trying to fight on. We're glad that there's some work that we can be doing at the state level to take steps forward, but our first fight has to be preventing these massive cuts at the federal level, because they're just so massive that we may be overwhelmed by them, even in a state like California.
Okay. Now, if someone wanted to contact Health Access, if they wanted to get involved, I know there's an event coming up on Monday, and we will be there. I will be there. Ms. Walker will be there, and the Raymond Hall Show is going to lend its support to whatever efforts that Healthy Access California has. But if the viewing and listening audience wanted to get involved, how would they do that?
So our website is www.health-access.org. It has lots of good fact sheets there about what's going on with this bill and this effort, as well as on a range of other issues. And you were right that we are proud to be working to help organize an event with Senator Kamala Harris in LA on Monday, and we're pleased that we have good representatives with our two senators and with the majority of our delegation. But even in California, we got 14 members of our delegation who voted for the House version of this bill, including Representative Knight in Los Angeles, including several members in Orange County, and we need to make sure that they recognize the severity of what they are supporting and the impacts to their own communities. Tens of thousands of people would lose coverage in each of their districts.
Now, is there a simple list where people can see all of the people of the California delegation that would voted? Oh, Ms. Cassidy is showing it to me now. Now, where's that list from?
That is on our website at www.health-access.org.
Okay.
It's part of the campaign that we're calling Fight for Our Health. Hashtag Fight for Our Health.
And it lists those candidates because Ms. Cassidy has a listing as well. Okay. All right. Okay. So, again, we want to thank you so very much for taking time out of your busy schedule. And now, is your office in Sacramento or your office here in L.A. or...
I'm based out of Sacramento, across the street from the state capitol, but we also have an office in LA as well as Fresno and Oakland, and we are trying to make sure that we move forward, not backward, but that's the fight of the next few weeks, is to make sure that the federal government does not do this dastardly deed to our healthcare system.
And a dastardly deed it is.
Okay, so now with these calls, when the people pick up the phone and they call the senators and they call their representatives, they're just merely calling in and saying and giving their name and saying that they oppose it, and they hang up the phone and that's it?
That's right. I mean, if people want to give a little bit of their personal story about why healthcare is important to them, why Medicaid is important to them, why Covered California is important to them, why that would be great. I think that the more that the Senate offices hear that, the better. But if folks want to just call and say, I'm opposed to Trump care, no on Trump care, no on, don't take away my health care, don't take away my Medicaid. Short, simple, sweet, to the point, that's good too.
Okay. Very good.
Well, ladies and gentlemen, the show today is about health care or no care. It's going to be our choice if we do absolutely nothing. So as Mr. Wright has told us to share it with us, to pick up that phone, to write a letter, to send an email, to tweet, do whatever it is that you need to do. This is not a black and white issue. This is a poor against rich and ultra rich issue. People want to always confuse things to make you not want to advocate for your neighbor if your neighbor is a little bit different than you. That's how these things happen. Okay? So we want to, again, thank Health Access. We want to thank you, Mr. Wright. And when we are in Sacramento, we're going to make sure we at least let you know we're there. So if you're available, we can stop in to see you and talk some more.
All right. Thank you.
Thank you, sir.
So much. Have a good day.
Have a good day. We'll be right back.
With the Raymond Hall Show.
All right.
Are we on a break?
And we are back. Thank you all for tuning in and viewing the Raymond Hall Show. I am going to say that I don't know what kind of consciousness a person would have to put forth something like this.
It doesn't make any sense, but then it makes all the sense because the bottom line is the greenback, the dollar.
Yeah.
The greed that is rising up, and we're getting a full view of it. So now there's not going to be any more excuses or rhymes or reasons. You didn't say, you didn't know. Mm-hmm. Everything is out in the wide open for each and every one of us to see. Now it's our turn to do what our grandmother and our great grandparents, all of those people fought for. This is our opportunity right now to carry the mantle forward and oppose things that we know are are detrimental to our the people
future of healthcare.
to the future of healthcare.
And Ms. Cassidy, you were saying that you have a more exhaustive list other than the 10 or 12. You have a list that's how many people?
24 representatives, and 7 of them are in California.
Okay, so we've got you've got a list of 24. Now, where can people go and view that list?
They can view that list at dailycos.com. That's dailykos.com.
So it's daily, and cost has a K. DAILYKOST.
KOS, no T.
Okay.
KOS.com.
Okay.
Okay, so spell it out for us.
Okay. DAILYKOS.com.
Okay, and what is the purpose, the overall purpose for the website? To do what?
This is a daily news website.
Okay.
And it lists all of the representatives who voted for this horrible, horrible bill.
Wow.
And it gives the state
That they're from.
Okay.
And their district. If you read the article, it gives their
So
first and last
if
name.
if I wanted to call into a state that I'm not a part of, can I call into the state that I'm not a part of? And
What I have found is that you can, if they have a Washington, D.C. office, you can call into their Washington,
Okay.
D.C. office. You can find out their telephone number by Googling their name.
Okay.
And it'll give how to contact them. Just say, how do I contact Representative Martha McSally, for instance, who
Right.
voted for this horrible bill?
and what state is she from?
She's from Arizona.
Wow.
Oh, our
Arizona. So
neighbor.
like he said, if you know someone in Arizona, I have a sister and brother there, they've moved to Texas. But if anywhere that you know someone that's not in the state that we're in, which is California, we need to get this information to them that they need to make these calls, give
Right.
their name
Right.
and their first name and their last name and their zip code.
Okay. You know, ladies and gentlemen, one of the things that we have had throughout eons of time is we've communicated. If there was a way to get something done, we communicated. We moved past whatever the challenge was or whatever the situation was, and initially what started it was that we communicated. Look, the most expensive form of care is through emergency rooms. Not only is it expensive in dollars, but it's expensive in the way the treatment is afforded.
Exactly.
You can be in critical pain, and you got to sit over there and wait. Okay.
And we've all had our experience in the emergency room.
Yeah. So we don't want to go back to that.
No.
And
Like something that Mr. Wright said earlier, this is not just the current rollback. This is 50 years worth of work
that they want to roll back.
That they are rolling back. So this is what's so important that, and it's going to affect you for 50 years to come going forward. This is just the same way they can just come in and roll something back that took place 50 years ago.
Right.
We're looking forward to 50 years going forward and the condition and the qualities that we're going to be having looking forward. So we all need to make sure that we pick up the phone and we make these telephone calls.
Okay. So you need to call in, what we're suggesting, you need to call into family, friends, acquaintances.
Yes.
Just ask yourself, who do I know in Mississippi?
Who do I know in Texas?
Who do I know in Texas, Indiana?
Ohio.
Ask this question because there's some biblical similarities here too.
Yes.
Okay.
I'm not a chapter and verse guy, but I remember what I read. And that was this king that wanted to get rid of all remembrances of this other person.
Right.
And he had him to chisel away all the
stricken from
statues, to take the name out and everything.
Couldn't even say the name.
Okay, so look at everything President Barack Obama achieved, and here is now. Remember, this is the person who was the leader of the thing about he wasn't a citizen. Remember,
the
for
birther,
years,
the birther, yes.
he's not a citizen. He's not a citizen. Then, and then when it's time to run, at close to time for the election, he's a citizen.
Right.
That's what's out of his mouth. But we see what the plan was. I'm gonna wipe out everything that you accomplished. I don't care who I hurt. I don't care what people I leave devastated. Just because I want to attack again, this is what I'm going to do.
Right.
His legacy.
His legacy.
Okay, so I'm confident. You heard some of the strangest things. Well, we need to give him a chance. Even when the man was wrong, we need to give him a chance.
And he's only been here for 5 months. For someone to have the type of impact that he's had in this short period of time, there's no way you can even know all of this information. I mean, you're all over the board. You've been there for 5 months. That's not a long time to...
I know they lock people up for some of the things that he's done.
Now, Mr. Hall.
Okay. I won't go there.
Well, we're going to let Miss Cassidy read the information that, the one on your card that you have there, that we can...
Okay, this concerns health care.
Okay.
Regardless to what happens on the federal level, there is something we can do on the state level.
Okay.
And that is to pass SB 562. It's a universal health care for Californians. Speaker Anthony Rendon, Rendon, is preventing this bill from even going to the floor to be voted on.
Wow.
And so...
So why is his
Why
reason?
is he doing that?
Why is he doing it?
Well, he got a big contribution from healthcare
industry. They lobbied him and gave him money.
When you say universal health care, what do you mean by
that means
universal?
a single payer where everybody would have the health care, regardless of what's happening on the federal.
On the federal. This is for the state.
This is for
state.
the state.
Okay.
No, but when you say everybody, please define everybody.
Well, everyone who qualifies. I'm sure that you would have to be a U.S. citizen or a minor child or...
Okay.
There's some other stipulations and guidelines,
Yeah,
but
there
it's
are
also this is an alternative to the federal fight that we're in. We also have a statewide fight,
right?
Things that we can work on as well.
Okay.
So now he doesn't want it to come to the floor for a vote,
right?
No.
So his telephone number is...
I thought California was ran by liberal Democrats. How did we have one person
He is a Democrat,
and he doesn't back this train up? Okay, so we have a Democrat who does not want
universal health care. That's right.
What's his name?
Anthony Rendon.
Mr. Rendon. What is he?
And it's SB Bill 562.
It's Bill SB 562.
Okay. Well, the only thing I'm going to do is he a representative? What is
yes,
he? He's a representative.
Yeah. And I wanted to read his address where you could write.
Well, here's what we're going to do. We are going to extend the invitation to Mr. Rendon. You come on down here and explain yourself, son. Okay, I would say representative. I guess I better say that to be politically correct.
His title is speaker.
He's a speaker.
Oh, so I can't say son. Come on down.
No.
Okay.
Take it easy now.
Take it easy. All right. Well, all right. Well, Speaker, we extend seriously an invitation to you. This is the Raymond Hall Show. It's about a different conversation.
Yes, it is.
We want to hear what you have to say. I'm sure what you have to say makes sense. Okay? It's easy for me to sit back and say somebody put a whole lot of money in your pocket. That's easy to say. It may not even be the truth, and most times a lie is easier to float than the truth. But health care is something that's vitally important to everyone. You know my story. I'm not going to get into it today, but if it wasn't for health care,
you wouldn't be here.
I wouldn't be here. Okay, so
none of us would be here. We've all had our health challenges.
Yes,
and so,
you have an amazing story.
Which we have a short time, but I will take some time in the near future to talk about my health challenge that I had. But I just want to say that this is a very, very critical time. and we have to pay attention and we have to do something. It's time out for playing and telling jokes and saying that we don't know. We know, so we have to make our moves and we have to make them strategically. So, Mr. Hall,
well, Miss Cassidy came right with it. She said,
that's
"You
what I'm
Democrats
talking-
won't get up and vote."
Exactly.
She said, "Y'all won't vote." Said a man won by 1%, and here it is. 20% margin in some states, and he wins by 1%.
And he's been here for 5 months, and he's already shaking the whole country up in every sense of the word.
Yeah, well, he need to quit mess. Oh, that's the president. Let me shut up.
Yes,
Look, ladies and gentlemen, Monday, July the 3rd, at 10 o'clock.
Okay.
At
I'm getting the information.
UCLA.
At UCLA. Oh.
Torrance.
Yes, UCLA Torrance. Kamala Harris will be there. Mr. Hall will be speaking.
Yes. Okay. Kamala Harris will be there. I've been invited to speak on veterans issues, so I'll be there. Ms. Walker, I'm sure she'll be there.
Yes, I'll be there by all means. I would love to be in the room with all of these power people that are making the decisions on my life, my children's life, my grandchildren's life, Mr. Hall.
Yeah.
And we're going to be there.
Okay. So, look, we need people to come out and hear what is needed. I'm a child of the 50s, so I get to be skeptical really quick. They can be doing an okadoke on one side, and then and on the other side we have to run to catch up to put that fire out,
right.
Because before you know it they doing something else. Because I just yesterday he said, well, we done moved on from that, we're gonna go on to the immigration issue, man.
Right.
Okay, so they got us running from pillar to post. Come out on Monday and let's hear from
July
the strategic
3rd
people.
At 10:15 a.m. Harbor UCLA Medical Center, 1000 West Carson Street, Torrance, California.
All right.
You can RSVP link at www.bit.l/July3 Harbor UCLA. General information, contact Nancy M. Gomez at mgomez@healthaccess.org. And we look forward to seeing you at this very, very important rally event.
Okay. Now, Ms. Walker is the technical guru for this company. I'm not going to even try to fake it. Yeah. So we will have that information up on our Facebook.
Yes.
Okay. And as she tell me, it's a work in process.
Yes, it is. So be patient with us. But we're trying to keep up with all you people out there. But again, look for us on Facebook about Monday. This health rally with Senator Kamala Harris will be there. She'll be in the building.
Okay. And we want to thank Elaine and thank our panelists. Thank Nancy and Rachel and all the people there at Health Access, and especially to Mr. Anthony Wright. Okay. Thank you for tuning in to the Raymond Hall Show. And here's my going out word. You people that's messing around with other people's computers, cut it out. Please, cut it out. You might be doing something to the big guy, but you're crushing the little guy. The people that's trying to do something, cut it out. Okay? Thank you for tuning in to the Raymond Hall Show. We want to thank Morris Media Studios for broadcasting our message here in the city of Los Angeles in the Leimert Park community. We especially want to thank the Morris family, both Mr. Morris and Felicia Morris, the owner of this studio. We want to thank all of you activists in the community.
Yes,
okay?
Definitely.
And we want to hear from you again. We want to know what we need to do to help support your cause. Ms. Walker?
Yes, I'm Errecca Flynn Walker with the Raymond Hall Show, and we look forward to hearing from you on Facebook, Twitter, and listening to our broadcast next week at 2 p.m. to 3 p.m. at Morris Media Live. Thank you. Have a great day.
Have a good night, you all. See you next week. Bye-bye.
Bye-bye.